Hi, my name's Rowland, and this is my 63rd day since being diagnosed with leukemia, Philadelphia positive. As the 63rd day, it was also significant because today is the first day of my third cycle of chemotherapy. And today that involved a number of things. Firstly, I'm an outpatient, so I'm not an inpatient in hospital. I'm an outpatient at the moment, which means I get to take my medications and visit the cancer clinic a couple of times a week, or whatever, as directed pretty much by the doctors and nurses at the oncology ward at hospital. So today being the first day of the third cycle of treatment meant that I had a few extra procedures. So firstly, I arrived and I had a series of blood tests. Those blood tests established the various levels in my bloods and also established if I could go forward with the two major procedures that I had today. And they were, one, I had a lumbar puncture, and the lumbar puncture is a procedure of where they inject a needle into the spine. They take some samples out and some fluid out, which goes away for testing into their labs to establish the cancer levels within the bone marrow and blood, and also they inject chemotherapy in. So they take equal parts out, equal parts back in, the chemotherapy back in. And the second procedure is a similar type of procedure. It's a bone marrow biopsy. It goes not in the center of the spine at the lower back like the lumbar puncture. It actually goes into its various side. They alternate it from right or left, and it is the lower back, but it's about an inch out from the spine, and they're still drawing into getting some bone marrow, and that is sent away for testing as well.
So I just had a double procedure, a lumbar puncture, followed straight away by a bone marrow biopsy. And that's the first time I've had two procedures, one after the other. The first one with local anaesthetic and the help of these, which played some nice music, followed by 15 minutes later the biopsy, bone marrow biopsy. And I got the use of the green whistle, which was actually really good. And I got through it. It's great. Really well done. Now I have to stay on my back for the next 2 hours at least, just so everything's fine, and then I'll be released for the day. Here I am at the centre. I'll just flip the screen. So that's the room I'm in. And I'm in the cancer clinic, so that's what it kind of looks like.
So far I've had 3 cycles, and so 3 of those bone marrow biopsies that I've had in that time. I think I'm on my 6th lumbar puncture now, and it's kind of unusual to have 2 of those procedures all in the same day. We had cross communications, and they thought I had a procedure which on the printed out list that I had for yesterday there was no procedure, but at the same time I had a blood test which they didn't, which I did have yesterday, which I should have had yesterday, which I had first thing in the morning. So I went through all of that, and the other thing is that they cleaned my Hickman's. That's the line that goes into my chest right here, and there's 3 tubes that are attached to that line. So that makes it easy for the blood and for the various medications to go straight in. It goes to an artery straight to the heart, and it makes it very easy. But they have to keep them so clean. Tip: always watch the regime of cleaning. It's got to be 30 seconds of cleaning and then 30 seconds of waiting for it to dry, 30 seconds of cleaning. It's a very precise measurement, and you'll see when they do set up for Hickman's cleaning, there'll be a yellow sorry, no yellow, a silver tray out, and it'll have all of these fluids, needles, gauze, and have all the sterilized gloves, everything there. It's quite a procedure to set up, and then it is quite a procedure to clean each of the Hickman lines and change the dressing. So you have to be authorized in order to do that, and you have to be an authorized nurse in order to access the Hickman lines. Otherwise, they're just coming for your blood out of the veins with needles. And so you've got to be highly organized because it's prone to infection. It's got to be kept really, really sterilized clean. And I mean really sterilized clean. And you have to take precautions because this Hickman line also means if you've got this, like I've been told I'll have this for about 6 months. That's a lot of time. You've got these lines hanging out of your chest. Makes it very difficult for showers. The best way, my tip is that for showers, I've gone to baths because I can lie down in the bath and I can keep this part of my body above, and so I'm still getting a good clean and enjoying a bath, but this is staying out, and I will get a sterilized surgical glove and I'll put it over the top and I'll just tie a knot in it for the duration of the bath, just to avoid any water or any moisture getting to it. And then get dry immediately, take the sterilized glove off, so there's no sweating or anything, just very quickly, just to protect, just that extra precaution. That's what I've done anyway. It mightn't be the sanctioned way, and it does look odd, so refer to your medical specialist, but I've just tried everything because I know that infection is a real thing and you need to take care of it. So let's come back to today, day 63, and it is September the 21st. So I went in, first thing was around 9:30 the blood test, and then 11 the first procedure, the lumbar puncture, followed by around 12 the biopsy, followed by around 2:30 the cleaning of the Hickmans and change of the Hickmans, and then after that time I was released. So I got out relatively unscathed, but those, when I say unscathed, those two procedures, a double whammy so to speak, is really knocks you around a little bit. So the lumbar puncture, what I do to prepare for that is I take my little and I'll just show you that, just the little earphones. I put on some soft music in the background. I can still hear the doctor. The doctors always, they're very calming. They'll inform you when they're about to put the needle in or they're taking it out. They're putting the anesthetic in and they're taking it out. And you sit on a bed, just like in a surgical room, in a one of those hospital beds in the surgical room, and you will bend over in sort of like this position. They might have a desk or platform in front of you. You have a pillow over that, and you just crouch on that, and the whole thing is they expose your back. They put a special bandage around it, around the area, just like they would a surgical area, and they pinpoint exactly between they fill and pinpoint exactly between the spine bones, and then they will go in with the needle, but you have to stay immensely still. They put a local anesthetic. The main pain that you feel is the first pinprick of the local anesthetic, and then that kind of numbs up, and then they'll take the needle for extraction. Now, sometimes they'll hit a nerve, okay, because it is very, it's a exact science virtually, and they have to and sometimes it's perfect, sometimes they might hit a nerve. Like today, there was a little nerve hit, and it hit my left leg, and I got a bit of a twitch in the left leg, but immediately the doctor adjusted by millimeters, and he asked me which leg so he could adjust to the right a little bit by millimeters, and it corrected the procedure, and there was no more pain then associated. But it was just a shooting pain down through the left leg, caused a bit of twitch. Fortunately for me, the twitch was in time to the music, so it was a little bit comical. And I had the right sort of music on this time around. There was one comical time the last time around where I didn't hit the smooth mix on my Spotify. I hit the 80s mix, and the first song was Boy George came on with Do You Really Want to Hurt Me? Do You Really Want to Make Me Cry? And it was just as the needle was going in, and that was painfully comical, but fun in the same time. And the ironic thing about that is that the doctor couldn't hear that was performing the procedure, because it was just my earphones, and because I'm holding still and leaning forward, I can't physically get to my phone to change the phone. So blaring in my ears is this over and over, do you really want to hurt me? Do you really want to make me cry? It's the things going in. So painfully comical. This time though, I had a better selection of songs, and they were nice, smooth, a little bit comical. I think I had one was called Flowers, and the other was Watermelon. Watermelon High or something like that, and it was actually quite appropriate to the next procedure. So I went through that. They extract the needle. They're telling you that then you've got to lie, after a lumbar puncture, you need to lie for about 2 to 4 hours on your back, because they just want to make sure that everything is right. They will come and check the dressing on your back just to make sure the bleeding and that everything is right, and before they send you off or go to the next procedure or can get up and walk around. And, you know, they care for you quite well. They check in on you. Sometimes the volunteer, if you're at the cancer clinic, will come in and offer you a sandwich and tea, and they're very lovely, the volunteers at the cancer clinics. Lovely people, wonderful people that just want to serve and help you out. So that's great. Then when that was over, about 15 minutes after that was over, which was pretty quick this time, we went straight into the bone marrow, because we were already there. So the bone marrow is a little, the bone marrow biopsy is a little bit different. Instead of leaning over like this, you're actually lying over and you're exposing your lower back. And the doctor will then again feel around, and he'll pinpoint with a marker or that they have down to like an X. X marks the spot like a map. And if they did the lumbar puncture on the left side the last time, they'll do it on the right side this time, because sometimes it's a little bit tender, a little bit sore from the previous time. And again, similar procedure. They will numb the whole area, but this time you get a wonderful thing called the green whistle, and I do recommend it. The green whistle, they can't use it for the lumbar puncture because you've got to sit really still, and the green whistle really relaxes you, and you can't hold yourself as still. But what the green whistle does in this, because you don't have to be perfectly still in this, it just spaces you out, really. You're sucking in on this green whistle, which is what it looks like. And firstly, it's just narrow breaths. Breathe in just naturally. And as you get used to it, you take deeper breaths. And it's really, it's a watermelon sugar high, as the song says. If you can, hear that. It's just spaces smooth, it spaces you out. And it's like, that's relaxed. And I tend to get through those better for that reason. So you do experience that first bit of pain going in, just with the first bit of anesthetic, but then it's numbed out. It's not; these aren't real, you just get a little bit tender afterwards. So they went through, extracted. The doctors are very good at just calming and telling what's going on, and then taking out. And that was all very good. It went through good. I was actually both proud of the doctor and proud of myself, because the doctor had performed, I think, 4 lumbar punctures before that, and doing this lumbar puncture, and doing the then the biopsy after it, which was no easy feat. It's a lot of concentration. He did really well, and I was proud of myself to go through a double, because I normally only have a single on those days, and come out of it really well. And as you can see, I'm sitting, I'm functioning. Other times I haven't been so well. I've been under the I guess the influence of the medication, and have just been really fatigued by now. And yes, I am feeling fatigued, but I'm up, I'm sitting, lounging around, watching some TV, just relaxing. Haven't done anything strenuous though. I haven't gone out for a walk or anything. This is probably my least activity in the last week, but I'm being cautious as well. Okay, so don't think you can just take on the world because you feel great and everything. Know that some of the things, so I've had double procedure today. I've had blood tests, and I've had my first round of chemo for this second round. That's significant. Be kind to yourself, rest, don't do anything major, keep your fluids up, eat your meals, and just, do the right thing. Don't try to, just because you feel good up here, doesn't mean that your body is going to be the same. Here's an example, okay? I've got what I call flipper feet, okay? So during this whole process, you'll know that you'll get sometimes pins and needles in the hands, pins and needles in the fingers, or pins and needles feeling in your feet. The way it plays out is that when you're walking, it's like from the knees down, you've got a lead weight. And you're from the knees down, it's on a bit of delay. So you're walking, but it feels like walking drunk in a way, because you're sending your messages to your feet, but your feet are slightly behind the rest of your body. They're a little bit heavier. So the way you notice, if you walk slow and then you pick up the pace, you suddenly feel that in your legs. So a good idea is, if you're crossing a road and there's no level crossing or anything, don't try to pick a short gap between cars, because you run the risk of, how you would normally cross the road and pick up your pace, you run the risk of actually falling over, because your legs aren't going to respond as fast as your mind says it to, and you might get across the road quite fatigued as well, breath. So be careful about that. I call them flipper feet because that's how they feel. They feel like you've got flippers and you're trying to walk in the water. You try doing it in shallow water, walking with flippers, and how it feels. They feel a bit heavier. They feel a bit harder to go through. That's today. I've got some further news I'll bring tomorrow about the transplant and the procedures, because I did have a late call with the specialist, but we'll talk about that tomorrow. Today, we went through, they did the Hickmans, they did cleaning of the Hickmans after us, and I was released. It's been a good day as far as because I've really endured some heavier medication, procedures, and here I am. I'm doing great, I'm doing well, and I'm feeling strong. And because I'm an outpatient, wow, this second cycle is 14 days. But I'm going to do that as an outpatient, unless they call me in. Like tomorrow, I'm being called in to get some additional medication, because I'm doing so well. They're actually going to up the toxicity of the medication to really try to hit the cancer hard and knock it down before things like a transplant. So they are really going to hit the levels which are currently 0.05 cancer. They're going to even try to push it further down, and in order to do that, increase the toxicity of the medication that they're giving me. They will give me a new medication for that, which I'll take at home, diligently take at home the medication regime as per instruction, and as we say in Australia and other places, Bob's your uncle. Well, may not be, but that's the upshot of it. Take the medication, follow things, keep yourself mentally good, keep yourself fit, That's the best way that you're going to overcome this. You don't have to lie to yourself. You don't have to do anything like that. There's reality, and you're going to have those moments. But try as much as possible to keep those negative thoughts away, keep your mind fit, keep your body fit, and you're going to do the best forward. But you'll see me on the journey. Thanks for watching. Please like and subscribe if this has been helpful. I know it's very targeted at someone who's going through this whole journey. It may also give people who are not some understanding of what someone who does go through the journey, what it's like. And that, but main thing, like and subscribe and become a donor if you're not. Go to Red Cross. It's easy to do. It's inside an hour. Little swab that puts you on the donor registry. If you ever become a donor, they'll give you some medication to grow your bone marrow transplants. And then it's just a blood. They just extract it from the blood. So it's not you don't have any lumbar punches. You don't have the biopsies that I would endure. That's for the patient. It's not for the donor. Remember that as you make your decision. Thank you so much.